Amalgam was soft for the first few minutes, but the composite is hard, so it takes a lot of effort. Now, what are some of the things that we can do with these ozonics? What are some of the opportunities? Well, it's very effective in our practice for generalized perio. Non-surgical, restores gingival tissue health, non-invasive periodontal treatment. Most of our patients want non-invasive treatment, and it restores gingival tissues to improve health. So, what are some of the tools we have? The unit comes with a whole mess of these. Now, you're not going to be able to get through it unless you actually read the instructions. So, I have to warn you, you're going to have to read the instructions on these because some of these are not intuitive. What I thought they were for is not at all what they were for. So it's a good idea to read the instructions at least once, but it's a complete set. They're made from glass, totally sealed so that you don't have any fluids going in. Treatment options. Well, here we have one of the heads, and this can be used on the soft tissue or on the perio. Here we can have a fistula that's coming out from an endodontically treated tooth, a periapical lesion, healed, simply by applying ozone. We kill the bacteria around the fistula. That's what does the trick. This is for endo. I didn't happen to have endo because I don't do endo in my practice. I send it out to a specialist, so I pretended to do an endo right over here. But this over here, you can see the light coming through, the ozone generation. When it's orange like this, it's actually generating ozone, and it seals off the tooth, kills the bacteria inside. And you saw before, you have millions of tubules, not millions, but hundreds of thousands of open dentinal tubules, all with bacteria. How are you going to kill the bacteria? Rinsing, the solutions will do part of the job, the files will do part of the job, but the ozone will do a better job than anything else that we have today. And here we have a unit or a tip that's great for surgical site. Either when you've extracted a tooth, if you want to kill the bacteria so it doesn't get infected, or if you're doing an implant, you want it to heal more quickly. If you put in a bone graft, tissue graft, you want it to heal more quickly and not be affected by the bacteria, this is the way you do it over here. And just apply that into the proper area. Now, some other tips that we have, this one is for desensitization. You have to put a little cap on it, and you put either on the occlusal or buccal surface of the tooth. This actually desensitizes by releasing ozone and concentrating it near the surface of the tooth in the area where it's sensitive. You have an aphthous ulcer, you have a herpetic lesion. I believe you showed one of these just a few moments ago, and just place it on. It doesn't hurt. Patient is comfortable throughout the whole treatment. There's no pain involved. They feel better immediately afterwards. They can report the difference in their sensation the moment you take away the ozone tip. It is that fast. The lesions disappear very quickly. And you heard the patients talking about it. I didn't actually understand what the patients were talking, what they were saying, but I know what they were meaning. And if you need to irrigate, well, you have water or a solution here, you ozonate it inside the syringe, and you dispense it into wherever you want to place it. Very effective, very rapid ozone displacement. Now, new technology. This is a new technology. You don't have it in your practice. Some of you may, but most of you don't. Do I need it? First question you should ask whenever you're looking at anything new, do I need it? Maybe you do, maybe you don't. And you know, the same parameters that make me need it may not be the same that make you need it. Depends on your practice, depends on your income, depends on your patients. A lot of variables. You have to decide this for yourself. I'll just show you how I decide for myself anytime I see new technology. Because there's another question. New technology, can I afford to work without it? It's not only how much it costs, but how much money is lost if I don't have it. How much am I giving away by not having this technology? For example, those of you who don't live on Hvar came here by ferry, right? You had to pay a certain amount for the ferry. The other option was to have a rowboat and to row across from Split. Now, for some of you, this might be practical. The question is, does the cost of the ferry make sense in respect or with respect to the time spent growing and the effort and time and so on. So you have to make this decision for yourself. It's not always going to be the same for me as for you or for everybody in this room. Every practice is going to be different. But here's how I do it. We have to make decisions in terms of the purchases that we make. Every dentist I know has a back room with lots of equipment and materials that he or she has never used. Does that sound familiar? And you know what that is? That is money. That's your retirement income sitting in that room. Dead money, exactly. You can't sell it. So you have to make the decisions before you buy, not after. After it's too late. You have to make the decisions before. How do you make that decision? Well, you can get a consultant in, but by the time you pay the consultant, you've lost money already. So you have to make the decision first time, every time. Return on investment. Has anybody here gone to business school? No, I didn't either. But I learned from my accountant about return on investment. What does return on investment mean? Net income as a percentage of original amount invested. For example, does anybody here have a certificate of money certificate or bank account? You put money into the bank, and then you get an income per year. Let's say you take $1,000 or whatever, and you put it into the bank, and they give you $50 at the end of the year. They're giving you back the original $1,000 plus the $50. That is